Greetings, this is Dr. Douglas Maurer from iMedical Apps with another medical app review. Today we're going to be taking a look at a new app from the National Health Service Scotland. This app is called Antimicrobial Companion. Let's take a look. If you go to our review, you'll see some links to other NHS Scotland apps that we've reviewed previously. We've been a pretty big fan of this group as they continue to churn out very helpful apps for providers in Scotland and across the NHS. So I currently have loaded the national template. However, this app allows you to download region-specific templates for the app. These templates include specific information for various hospitals, antimicrobial resistance information, etc. It also allows those regions to collect audit data regarding antimicrobial stewardship, which is the real purpose of this app. It gives you some nice information about who this app is for, what it does, how to use it, built right into the app. It includes several calculators for inpatient use for antibiotic stewardship, including a vancomycin and 2 gentamicin calculators. It has this very handy primary care antibiotic guidance. Gives you some kind of generic information saying, well, there's more than just this, and different regions may have their specific information, so you should go and download that. But for example, under upper respiratory tract infections, it gives you helpful tips of how to avoid antibiotics. It gives its own Centaur criteria-like score that it links to decide who should get antibiotics, including numbers needed to treat, numbers needed to harm, etc., and the antibiotic doses for a variety of upper respiratory. You can see it's pretty much has the same kind of information you might find on the Sanford Guide or Johns Hopkins Guide, at least when it comes to the diagnosis, the specific antibiotic, and the dose and route. Certainly it doesn't have all the other information, references, etc. that you can find in those apps, but this app is free, those are not. You can see here again information, including links to various guidelines. These all are just internet links. Some of the guidelines I noticed were not available in the outside of the UK, but you can get an idea here of what it's recommending and how to be a good antibiotic steward as antibiotic resistance continues to climb. The final section of the app has this UTI decision aid, which is really to help nursing staff and patients who are in a nursing care facility decide whether or not they should receive antibiotics if they have urinary tract symptoms. It walks you through a step-by-step mnemonic of who should or shouldn't get antibiotics. Simple yes-no information to follow regarding who to treat and who not to treat, since urinary colonization is very common in patients who have indwelling catheters or live in nursing care facilities, and antibiotics likely are not going to be helpful for those patients. Also has this nice global search option built into the app. So things I liked about the app: the interface, as you can see, is very easy to use. It's laid out very cleanly. It includes these handy-dandy antibiotic dosing calculators, which I neglected to show you. You can change the units here. Otherwise, it's pretty straightforward. They do require creatinines in a somewhat unusual micromoles per liter, which is not the standard used in the facility I work in, so you'll have to calculate that over to come up with the correct creatinine conversion. The primary care section, I think, is really the money of this app, as it has pretty much every type of common infection seen in primary care, with recommendations of what antibiotics to use, and more importantly, when not to use antibiotics, so as to spare folks the risk of antibiotics and breeding resistance. This app is also one of the few out there, recently at least, that I reviewed that is available for both Android as well as iOS, so that's nice to see for a change. Some things I wasn't so fond about, I kind of already mentioned on the interface here. It'd be nice to have the option to change the creatinine units. Some of the fonts and whatnot on these calculators could be somewhat improved, but they get the job done. The primary care section, although as I stated is very helpful, it doesn't have a ton of information about the antibiotics themselves. It just simply says if you have this, treat with that. So it'd be nice to see a little more information about side effects, other drug interactions, etc. I guess for that you're going to need to use a Hopkins guide or a Sanford guide. Finally, some of the guidelines, as I mentioned, that you try to link to are only available in the UK, so that may not help you all that much. So, for example, I believe when I was looking up this site is only available from Great Britain, so that's unfortunate. But minor technicality since this app is really geared towards